Hi, my name's Gail and I'm an advanced pharmacist practitioner working within women's services at Dr. Grayson Elgin. I have a special interest in prescribing and lactation and have recorded this video to help you to control your symptoms of hay fever whilst you're breastfeeding your child. There are many non-drug interventions that may help to ease your symptoms as well. Things such as wearing sunglasses, keeping your windows and doors closed as much as possible, staying indoors, showering and changing your clothes regularly to reduce and remove pollen deposits, vacuuming regularly and dusting with a damp cloth. Regarding medication, it's important to know that you don't have to suffer whilst you're feeding your child, and there are many medications that are suitable for you to use. When looking at the medications, quite often the patient information leaflet inside will say that it's not suitable for use in pregnancy and breastfeeding. This tends to be down to the licensing of the product and the fact that it's deemed not ethical to do clinical trials on these patient cohorts. However, we have many specialist resources with available data that we can look at when we are given information on safety profiles of medications. So looking at the medications, antihistamines tend to be a very commonly used medication as they offer a one-step method of controlling your symptoms. So the antihistamines can be split into two separate groups. We've got non-sedating antihistamines and sedating antihistamines. So we would prefer the use of non-sedating antihistamines in breastfeeding. Cetirizine and loratadine are commonly available in community pharmacies and have lots of safety data associated with them. But it's good to know that all of the other non-sedating antihistamines don't have any safety issues reported with regards to the breastfed infant. So if a non-sedating antihistamine is deemed clinically necessary, then chlorphenamine has got the most safety data associated with it, and it should be used at the lowest effective dose for the lowest period of time. Things to think about if using a non-sedating antihistamine would be to monitor for drowsiness in the breastfed child, and also to adhere to safe sleep guidance and make sure that co-sleeping doesn't happen. So in addition to oral antihistamines, we've got oral decongestant tablets as well. It's best that these are avoided due to the fact that they can have an impact on supply, and this impact can actually be worse if you have been breastfeeding for a longer period of time. Nasal decongestants are thought to be safe in breastfeeding due to the small amounts that enter the bloodstream. And therefore it's very unlikely that they will accumulate in the milk supply and have any impact on the breastfed child. Other nasal sprays that are available include steroid nasal sprays, again found in very low levels in the bloodstream, and also there are the preventative nasal sprays that tend to trap pollen deposits and stop them from entering the wider system. Eye drops are fine for using due to the way that they are applied. Again, they don't enter the blood supply in large quantities and therefore won't enter the milk supply in large quantities. I hope you found this informative and helpful, and if you have any questions you can pop them in comments underneath this video, and also we would love suggestions for videos regarding medications and breastfeeding going forward. Thanks for listening.